Competence in the clinical skill of phlebotomy is demonstrated by uploading 10 videos for review by the course instructor. The technical requirements for these videos include real-time continuous audio and video throughout the clip with no evidence of editing. Additionally, each video uploaded must be accompanied by a signed consent form that includes consent for the student, supervising clinician, and patient or model to appear on the video, and for the patient or live model to participate in phlebotomy. A sample consent form is provided in the phlebotomy module. Hello, sir. Can you tell me your name and your date of birth?
Louis Strada.
And your date of birth?
April 2nd, 1976.
Okay. We're going to draw a couple of tubes of blood for the lab work that your physician has ordered. The student will introduce him or herself and his or her role as a medical assistant. The student should also identify and introduce the clinical supervisor present for this invasive procedure. The student will explain the purpose of phlebotomy to the patient and the steps involved. As part of the initial introduction, the student should confirm the patient or model's understanding of the procedure and elicit their verbal consent to proceed. For example, "Hello, my name is Joseph. I'm one of the medical assistants here in the clinic today. Can you tell me your name and date of birth?" "Thank you. Here with me today is my clinical supervisor. His name is Dr. Malik. As you probably know, your provider has ordered a couple of blood tests today. Have you ever had blood drawn before? Have you ever had difficulties with blood draws? Are you left-handed or right-handed? Right? Then if you're ready to proceed, I'll ask you to roll up your sleeve on the left while I wash my hands and get some gloves. This procedure will be similar to your previous experiences. I'll place a tourniquet on your arm. I'll clean your skin with some alcohol. I'll take a blood sample for 2 tubes. Once the sample is collected, I'll remove the needle, apply some pressure, and cover the site with a bandage. Are you ready to proceed? Great. The medical assistant should demonstrate knowledge of infection control standards in patient care by washing hands before and after patient contact and demonstrating the use of gloves in patient care when clinically indicated. For the clinical task of phlebotomy, the student should wash hands with soap and water or use a hand sanitizer prior to the use of clean, non-sterile gloves. It is important for the student to demonstrate his or her knowledge that it takes time for germs to die with both hand washing, hand sanitization, and the use of alcohol wipes on patient skin. Don't rush through these important basic skills. Hand washing is a good time to briefly review the procedure with the patient and to answer patient questions. The medical assistant will position the patient appropriately to provide access to the antecubital space. The medical assistant should position him or herself so as to access the patient's arm laterally. The student will read aloud the labs ordered on the signed consent form associated with the phlebotomy module. Demonstrate knowledge of the correct lab tubes and equipment to be selected from the choices available on the phlebotomy cart. The student will select the appropriate vacuum tubes, needle, hub, alcohol wipe, tourniquet, and bandage, and position them for ready access during the procedure. After placing the patient in the correct position and collecting all the required supplies, the medical assistant applies a tourniquet to the upper arm. The tourniquet should be tight enough to obstruct venous return, but not so tight as to obstruct arterial blood from flowing into the limb and distending the veins. Next, the medical assistant identifies a vein for puncture in the antecubital space. Once the vein has been located by palpation, it is cleaned with an alcohol wipe in a circular fashion. After the vein is cleaned, it is punctured with a sterile needle. With the needle fully under the skin, the first tube is advanced onto the needle within the hub. If the blood is not immediately returned, the needle is advanced into the vein. If the needle is pulled out of the skin before blood is returned, the lab tube will lose its vacuum and must be discarded. The lab order from the provider for this procedure will require 2 tubes be collected. The medical assistant must demonstrate that he or she knows the correct order in which to collect various types of samples. The medical assistant must release the tourniquet before the first sample tube is filled and definitely before the needle is removed from the vein. The sooner the tourniquet is released, the less bleeding and bruising there will be upon removal of the needle, and the more accurate the venous blood sample will be for the lab studies. Once the needle has been removed from the patient, the medical assistant applies pressure with a cotton ball. Once venostasis has been achieved, the puncture site is covered with a bandage. If the patient becomes lightheaded or faint, the medical assistant safely interrupts the procedure and prevents injury to the patient. The lab order from the provider for this procedure will require 2 tubes be collected. The medical assistant must demonstrate that he or she knows the correct order in which to collect various types of samples. The medical assistant safely removes the contaminated needle from the hub and discards the needle in a sharps container. The sample tubes are labeled with the date, time, the phlebotomist's initials, and applies a lab report label that contains patient name and date of birth and lab requisition serial number. The tubes are placed in a plastic Ziploc bag. The medical assistant removes and disposes his or her gloves appropriately and washes or sanitizes his or her hands before returning to patient care duties with this or another patient.